Now for the next possible cause of hypertension in children, sorry, let me get something. Okay, is what is known as the endocrine causes. Endocrine causes is like you trying to talk about hormone imbalance. So as the hormones are not balanced in children, some particular hormones which we'll get to talk about, it could actually result into what? Hypertension in these children. So endocrine causes of hypertension in children they are rare, okay, but they are very important to recognize. Do you understand? Because it involves hormone imbalance, okay, and if you understand the basis of this, you can now go for the right drugs that could further treat these conditions in children. Now, the first endocrine issue that could cause hypertension in children is what is known as a congenital adrenal hyperplasia. This one, you have enzyme deficiencies, okay, like 11 beta hydroxylase, 17 alpha hydroxylase. So it leads to what? The excess production of mineralocorticoids or androgens. So androgens, if there are so much in the body, they lead to what? Retention of sodium. Sodium, on the other hand, will lead to the retention of water. So such children, they have elevated blood pressure because there's too much fluid held back in the body because of what? The excess androgen production. Then we have the primary aldosteronism. Okay, that's also known as the Conn's syndrome. It's rare in children, but it's caused by adrenal adenoma. That's a tumor in the adrenals. Okay, so it causes hypertension. We have the Cushing syndrome. That one is excessive cortisol, right? Every medical student should know this one. Okay, so excess cortisols. So the child is obese, has a moon face, okay, growth retardation, and the rest of them. Now, because of cortisol is too much, usually causes what? Hypertension too. Then we have the Pheochromocytoma and the Paraganglioma. Okay, that one too is a tumor of the adrenal medulla. It secretes a lot of catecholamines. Okay, so there's headaches, there's sweating, there's palpitations, and there's also hypertension associated with that tumor. Then thyroid disorders. Okay, so if you're having hyperthyroidism, one of the characteristics is there's increased cardiac output and it increases the blood pressure. Then acromegaly, excess growth hormone release. Okay, so it can actually lead to hypertension, okay, because growth hormone retains sodium back in the body. You understand? The diabetes mellitus type 1 and type 2, hyperglycemia can lead to what? Nephropathy. So if there's too much glucose in the body, it gets deposited in what? The nephrons, known as nephropathy. In the retina, known as what? Retinopathy. In the nerves, known as the neuropathy. Do you understand? So it could actually cause hypertension in children too. So for disorders of endocrine, that's hormone imbalance causing hypertension in children. Those are the examples.